What happens when you get COVID-19? Do we all need to be admitted into hospital? And how do you take care of yourself when you actually have COVID-19? Hello everybody, my name is Dr. Xuereb and I'm a crisis psychiatrist working in Malta and Gozo. With me once again is our top expert in the field, Dr. Chris Barbara, Head of Department of the Pathology section. Chris, over to you. What do we do?
Basically, anyone who gets this infection with this coronavirus, 80% of people just get a very mild illness, okay? It's like a flu-like illness. So these people, the important thing is that they keep monitoring themselves, they check the temperature, check for any new symptoms every day. They can virtually talk to their doctor, their family at home. So they have to stay at home. The important thing is that they do not spread it to other people, and we are monitoring themselves, or these people are monitoring themselves by even talking to their family doctor virtually without him exposing himself. And if there's any problem, then of course he will tell them what to do. Those are the vast majority of cases. Okay?
So people are getting better, people are getting cured.
Of course. Some people have already had the infection without themselves knowing.
Without themselves knowing.
So they have now already developed immunity and protection against this infection. And we're doing a few tests today to check whether people are immune or not.
Right.
So that is the vast majority. But then we come to another group, which is about 15 to 17%, where these people might have some other comorbidity, or else maybe their immune system is not fighting it well enough, and these people might get more symptoms and might need admission to hospital.
So like shortness of breath, fever, dry cough and sore throat, and maybe bowel cramps.
Exactly. It's a persistent dry cough mainly. And today they're saying as well, some people get loss of smell and loss of taste as well.
Which can happen in other viral infections as well, so it's not specific to that. Okay, so you're at home, you have mild symptoms. How do you take care of yourself? How can you nurse yourself? What should you do and not do, or take and not take?
First of all, control the fever if you have any. Okay, there are lots of antipyretic drugs people can take.
Against fever, antipyretics?
Some people might, like me, might not like taking lots of tablets. I use a face cloth on my forehead, which works just the same.
Okay.
Keep yourself well hydrated, eat well, so ask your friends to do the shopping for you. You'll find it behind the door, and do some nice cooking at home. And usually within a couple of weeks you should feel much better, and you are take swabs again to make sure you are not shedding the virus. Okay, when you get 2 consecutive negative swabs, the public health will tell you now you are free from disease, but they will probably leave you a bit more home on your own, so that you will not spread the virus to others.
Okay, so when you're cured, are you still infected?
Usually not, and that is why they tell you that you need 2 negative swabs.
And who does the swabs? Do they come home, or do you have to go somewhere?
No, you can go in the car on your own, okay? And there is a drive-in is the word, and they swab you there and then, and you get the results later on during the day.
Okay, so should we be alarmed or not at this stage?
Unless you are one of the vulnerable group of people with comorbidity, in most cases, people are part of these 80%. But then there are a few where the virus can affect the lungs. Your immune system reacts very strongly against the virus. We say you get medically a cytokine storm in the lungs, and of course some people can get worse, and these need hospitalization. Because the infection is within the lungs, okay, then of course you might have lack of oxygen, and 5% of people might need admission to an intensive therapy.